here. A lot of you probably already know, but you already know that the Forest Service found alarmingly high levels of toxic metals and moss across Portland. And for many of us, that was a big wake-up call. A lot of the people that we're going to hear from today, however, have known about these issues and have been fighting to solve them for many years. The Department of Environmental Quality, DEQ, and Oregon Health Authority, OHA, are telling us that now we're safe, but we know that the problem is not solved. We know that safety benchmarks are being moved to benefit industry and not to benefit public health. We know that Portland air quality ranks at the bottom of all U.S. cities. And it's our hope that Oregon will reform our air quality regulations to at least match those of our neighbors in California, and yes, even Washington has better air quality regulations than we do. We need a big paradigm shift. We shouldn't have to prove that we're sick. Industry should have to prove that their emissions are safe. What we can all do to help just today even. We can call Governor Brown and tell her that we want stricter air quality regulations, join our neighborhood groups and our neighborhood air quality groups and ask them to put air toxics on the agenda for just the regular neighborhood groups. And the neighborhood groups are it's great to sign up with them because no matter what issues happen in Portland, these neighborhood groups are all connected to each other and connected to the city, and they're a great way for people to be able to connect with each other and then branch out on these special issues. And we can also reach out to our friends all over Oregon to ask them to do the same things, because this fight isn't just about Portland. It certainly isn't just about one neighborhood around Bullseye. It's about the entire state of Oregon. And also, I have to ask you to join EPAC. Go to eastsideportlandair.org. You can join us. You can join your other neighborhood air quality groups. And if your neighborhood doesn't have one, we would be more than happy to help you start one. So let's kick it off. We're going to hear from some speakers who are going to help us understand the issues better and help us understand how we can take care of ourselves. Our speakers will be available during the Q&A after Erin speaks. So I'd like to introduce our first speaker, who is Tamara Rubin from Lead Safe America.
My name is Tamara Rubin. I live in Selwood with my husband, and we have 4 boys. And some of you know me because I have an X-ray gun. And this is an X-ray fluorescence spectrometer. Well, then I forgot to start my timer. This is an X-ray fluorescence spectrometer that instantly tests for lead, mercury, cadmium, arsenic, chromium, nickel, and any heavy metals. And we're offering free soil testing at Lead Safe America. We had a group of you all come volunteer, and we tested, I think, about 1,000 soil samples a few weeks ago, and we've got probably another 500 or so, maybe not quite that much, in the office to test. We're testing them every 2 to 4 weeks, and you can bring in your samples, and we'll test them for free. I also give away free lead paint test kits because the focus of my work is lead poisoning prevention, hence Lead Safe America. And these are donated by 3M. They cost between $10 and $15 in the store. And they're also good for consumer goods testing. And so we gave away over 100 of these, and we ran out today. I didn't know how many people to expect, so yay. But if you want one of these, just come by our office and we'll give you a free lead paint test kit. And so my focus here, my little spiel, is supposed to be about the impact of environmental toxicity on children and how corporate irresponsibility and government corruption brought us to this place. So in terms of the impact on children, I always speak from first person on that. And my children were poisoned in Irvington in 2005 when we hired a painter to repaint the exterior of our home. He used an open flame torch to burn the paint off the exterior, which my children inhaled the fumes, but likely also poisoned the entire neighborhood. Both demolition, sanding, open flame torch burning, these things are adding to the air burden of our city. And the thing we have to think about is not any one incidental exposure, but the aggregate environmental toxicity we're exposing our children to. My son now is 11 years old. He was 7 months old when he was poisoned acutely and had a blood lead level of 16. And the doctors had refused to test him for 2 months after he was poisoned because we were white and middle income, and they were focusing on testing low-income African American and Hispanic families whose kids were in Head Start and WIC. And so there was a de-emphasis on testing anybody they felt didn't fit the CDC's model for who could be poisoned by environmental toxicity. So that's when I started learning that the CDC has kind of an alternate agenda, and later I learned that, in fact, they're influencing the lead industry is influencing CDC public policy standards and statements. But in the meantime, my son, now 11, has a significant brain injury as a result of his lead exposure. His visual memory is in the 4th percentile, and so even though he has 130 IQ, which is near genius, he's still not reading nearly anywhere near grade level. He's reading at like a pre-K level, and he's in 5th grade. And he also has issues with impulse control, ADD issues, dyslexia, immune system issues, a whole host of issues that have been directly linked to environmental toxicity exposure and well studied. And I just wanted to illustrate the corporate irresponsibility part with this. This is my prop here. It seems somehow relevant, but again, talking about aggregate environmental toxicity. Who has one of these? Raise your hand. Whose grandmother has one? Whose mother has one? Everyone should be raising their hand, right? For the husbands who don't know what this is a vintage 1950s Pyrex mixing bowl that is milk glass on the inside and painted on the outside. These, when I test with my XRF, well, first off, the amount of lead that's considered unsafe for a child in a toy is 90 parts per million lead. And there's no regulation for the amount of lead available in total lead content of consumer goods, even in cookware, only for leachability. However, these items test at 80 to 110,000 parts per million lead in the color on the outside. And then when you hold them up to the light, you can see the scratches and where the lead's worn off. And where has that worn off? Well, they nest. And each one goes into the bowl that it goes in. And they go into your dishwasher and it goes in all over the place. And not only does it test with an XRF, but it also tests positive with a lead check swab, which is a reactive agent swab testing. And these turn bright red when you test something with lead in it. And so what has happened with, in terms of the government influence on this, and I'll try and wrap this up really quickly, as just an example, is that recently, last year, I testified in an EPA hearing where the company that makes this doesn't want these consumer goods testing available. So they told me they will no longer sponsor me. So I had to buy this. This is a $50,000 instrument. Luckily I got it used for $22,000. And they don't, and the CDC is trying to make this consumer available test illegal because it tests down to 600 parts per million, but they only consider lead toxic in paint at 5,000 parts per million, and they don't think that, they want a test that's less sensitive so that they can test to the level that HUD requires that paint be remediated in low-income housing, which is 5,000 parts per million, when in fact the 1978 law that outlawed lead paint said paint couldn't test higher than 600 parts per million, and now consumer goods laws say children shouldn't be exposed to lead at above 90 parts per million. So we have the CDC right now spending millions of dollars on a private contract to try and create a reactive agent swab testing that's less sensitive so that it complies with the out-of-date HUD standards that are not protective of children.
It is good to be here. It is nice to meet you. I always start off with a joke to lighten the mood. So, ladies and gentlemen, hello. I'm Erin Brockovich, not Julia Roberts. You'd really have no idea how confusing that's been for the past 20 years. And it continues.
You're better.
Thank you. I go into grocery stores and stuff, and people see my ID, and they're like, oh, Erin Brockovich, that's the name of the film. And I go, yeah, it is, and I'm the real Erin. They're like, no. You're not Julia. I know. So they think it's strange, but I could share a lot of fun stories with you. My parents offered me a great foundation, and that's the one that I work from. And that was one of values of respect and appreciation for our neighbors and ourselves, and that the greatest gifts we have are our right to clean water, clean air, and our health and welfare. And I've never forgotten what my parents taught me. I remember my dad telling me in my lifetime water would be a commodity. I think is going to be right. And my mom teaching me to question everything. And I didn't always appreciate everything my parents were teaching me. And I learned a lot by common sense until I had my own children and until I stumbled upon the situation in Hinckley, California. And I mean, I stumbled upon it. Things didn't make sense to me. And I was often put off or was given roadblocks or obstacles to asking questions or doing what I was doing because it's like, well, are you a doctor? Nope. Are you an attorney? Thank God, no. I go, are you a scientist? And I'm like, no. And I'm like, why are you asking me all these questions? Well, because you're asking questions about hexavalent chromium, or you're asking questions about why these people have this. And I'm like, well, I didn't know that I had to be any one of those things to be a human being and to ask a question. And I think that that happens many times for all of us. And oftentimes, because we get put in a category, whether you are or you aren't something, oftentimes we're afraid to speak up. We're afraid to speak out because we're afraid what somebody may think of us or we're judged. And I found myself in that very same situation when I was doing my work out in Hinckley. And, you know, they would love to convince me that what I saw wasn't real. That really drove me insane. So I'd be looking at green water and a two-headed frog, and I actually have a representative from the company telling me, well, that's the standard, we see it all the time. I'm sorry, there's children in here. I can't tell you how I really felt about that, but I'm like, I'm not buying that BS, okay? Because I know what I see, and you're not going to convince me what I see isn't real. And this happens in communities a lot. And so what I'm very proud of to see is all of you here and beginning to ask questions and beginning to push back. And that can be very effective. In a way, we've all been lulled into a false sense of security. And I've watched this process happen over the past 22 years. And you're not alone. When I began my work in Hinckley in 1991, I went to put my finger in the dike to stop a flood. I had no idea that it wasn't just that one, and it wasn't just 100, and it wasn't 1,000, and it wasn't 10,000. It's a problem throughout this entire country. It's a problem throughout the world. And we're going to have to get back to our environment, which sustains every single thing we do. And begin to change our models and our priorities and how we're going to handle this, because we won't be sustainable moving forward if we don't make changes absolutely right now. They needed to happen yesterday. And that change will begin with you. Sometimes I'm the bearer of bad news when I go to communities. And they're like, well, we're feeling better because, you know, the EPA is here and it's good. And I'm like, oh, no, you're screwed. Many people and I have challenging, fun conversations about this when it comes to governmental agencies, because there are very well-meaning people within those agencies. But we do have some problems, and I think that we're going to have to address them. And so we have expected at some level that because they've said they've done, therefore it's happened. And I think that we've been lulled into somewhat of a false sense of security. And we're in this moment, we're watching it unfold before us right now, where we're beginning to change. You're beginning to change. People move the dial. And I think that moment has come where we will rise and use our voices, and we will be heard, and we're waking up from that sleep and realizing, oh, no, you don't. Things haven't been going the way you've been telling me they're going, and I've got something to say about that. So the change begins with you. And so when I deal with communities, you know, I just look at them and I hear, well, these agencies are here, and this is what they're telling us. And it makes me sad when I look in their face and I tell them, you know what? Superman's not coming. Not coming. So here's my tagline. Since Superman's not coming, guess what? Tag your it. You will make the difference. You have to believe that. You have to see the people here tonight. You have to see your communities. It's happening everywhere, where we're coming forward and we're speaking up and we're speaking out. I don't come into these locations, I don't think Jennifer and all the incredible women I have met come into these situations to be this big, you know, SHIT disturber, and we get labeled a whole lot of stuff. It's about creating awareness. It is about providing information and tools and education to communities so they know how to begin to protect and defend themselves. And that's what's most important. And there is such a lack of transparency between communities and industry and between communities and government. It astounds me. And all of this is born out of a seed of deception. Every single case I'm involved in every single community, it begins with a lie. And out of fear or greed, somebody doesn't want to tell you something. And that's the moment every problem begins. And I think everyone thinks we can't handle the truth. And nothing could be further from the truth. What people can't handle is the lies. That's what they can't handle. Tell the truth. And so you're in a situation now where you're starting to find out some of the truths. And we don't have all the answers today. Today is a learning curve for me as I learn from you, and questions and answers, to hear what Robin has to say. You know, people often want to know if they have legal recourse. In some instances you do. And it's important to know, especially for a situation involving children and heavy metals, and looking at medical monitoring options, because chemicals have long latency periods. You know, people could be exposed to hexavalent chromium when I worked out there in 1991 and be 7 years old and have drank that water since they were born and continued to drink it for 7 more years, and then start finding themselves with illnesses or diseases at the young age of 19 and 20, because latency periods run. And we're seeing more and more youth, by the way, with more and more diseases throughout the entire country. I'm often perplexed that when we are exposed to pollutants at high levels, varying levels of solvents and heavy metals in the environment, and then down the road we have a population that's sick, that we disconnect and we can't associate the two. We are the environment. We are the water, we are the air, we live, we breathe it, and we have and we cannot continue to use our air resources and our municipal water supplies as a dumping ground of all of our waste. It's just not working anymore. It never did. And so when we get involved in situations like this, you know, here you have, I'm sorry, I'm not the one from the state that came out and told you don't eat the food from your garden because, oh, oops, it's been poisoned. I mean, this information didn't just come up yesterday. Somebody's known about something for a while. And they found in some of their testing arsenic and cadmium at 159 times, 180 times what the state benchmark was, and issued a warning you shouldn't be eating in your gardens. So then there's a voluntary program where Bullseye stops doing that, and now the numbers come down, and now suddenly there's going to be an all clear. I don't know that it works that way. I think they know it works that way. And here's how it won't work that way. Because of you. Because you will speak up and you will speak out. And that's what will make the difference here. But I want to know, and this will be an investigation for us, how long has this been going on? What were the numbers? What you see today was probably a higher number back then. I remember when I began my work out in Hinckley in 1991, I read a report dated 1991 that they still had hexavalent chromium in the drinking water wells at 5 parts per million. Parts per million. That's hazardous waste. Maybe it's because I'm a dyslexic and I think backwards. The first thing that came to my mind was, wait a minute. If it's 5 ppm today, what was it back in 1981? What was it in 1971? because that's a lower end of a number coming from a higher number back in time. And you can, and experts can model that, and you can prove that. The levels in Hinckley in 1962 were 50 ppm. See, this is what people were exposed to. This is why we're dealing with disease. And this is what I want to find out and discover here. How long have you known? What were the levels yesterday? What were the levels last year? What were they 5 years ago? That's the information that this community has the right to know. And so that will be a part of our job, and that will be a part of your job too. You know, communities tell us all the time, you know, we don't necessarily know exactly how to begin, even though they do. Thank goodness for social networking. Oh my gosh, I honestly don't know how I did my work back then. It's so antiquated. I mean, I had a cell phone bigger than this bottle of water, you know, hooked up in my car. I thought I was so cool. It's amazing, isn't it? But it's such a double-edged sword, but social media has really connected us together again. We worked in a community in Fridley, Minnesota, and it's a super fun site, and there's like 7 different defendants, and nobody's really getting involved because he said you did it and she said you did it, and they're just not getting anywhere. And this entire community is riddled with TCE, and they're like, what do we do? And we got them to start their own Facebook community, and because, see, people move away. We forget that. And we were astounded what happened with this community. That Facebook grew to about 7,000 people in under 2 months that grew up there but had moved away from there. You know what really blew our mind? 800 of those people had cancer. So we're migratory. We move away. But now with Facebook and social networking, we can learn information. And without that knowledge, you know, we can't make the right choices or different choices when it comes to our health and our welfare. And for me, that's what's so important. So you might even have already started a Facebook community where you have an outreach for people who were moved away from this area that can report back to you. That will tell us a lot of information. I oftentimes ask people, do you go to your own city council meetings? Here is where we're waking up from this slumber, whether it be we think the EPA's had the oversight or the state or the DEQ, but let's get right down to that local level. Boy, howdy, a lot of things can go on in there. And if I've been to them. Have you ever been to them? There's nobody in the room. They're just sitting there talking to themselves. And half the time they have no idea what's going on. Well, that's what I'm going to say. Start going to your local council meetings in numbers. Know their faces, know their title, know their phone number, and start calling them day in and day out. It actually makes a difference. It does. It does. We had a situation in California, in Carson. And city council, there you go, same people, you know, they're just talking to themselves. They thought they were going to get off the hook this day. They go, okay, is everyone here? And we said, no, we have some people outside from the community that would like to talk to you. They did not know it was 4,000 people. It's true. Every single one of them filed in there. And what they did was they brought with them stuffed guinea pigs from their children and from adults. And they wrote a letter about what it is they were suffering health-wise. And they safety pinned it to the guinea pig. And those guinea pigs were a pile in this room. And this community said, we are not going to be Shell's guinea pigs anymore. Ever again. And city council was moved. And they listened. We all did. Till 2 o'clock in the morning. And the next day, they got down to the Los Angeles Regional Quality Control Board, and I'm telling you, some heads started to roll. And these agencies need to hear from you, the people. And don't back off, because they'll say all kinds of stuff to get you to go away. And see, that is key. I learned this from my mom. Well, you know, again, my cheerleader, and being a dyslexic, I'd always come home from school feeling really frustrated about something. And she, again, as my cheerleader, oh, Erin, you know, where's your stick-to-itiveness? Listen, I'm from Kansas. I thought it was a slang word like slaunchwise or cattywampus. And I'm like, Mom, I don't even know what stick-to-itive, stick this somewhere. I don't know what you're talking about, but it's really frustrating me. And so she left the room to return with the Webster's Dictionary. And I shouldn't have challenged her. My mom was an English major journalist. She had great command of the English language. She said, well, sit down. I want to read you something. It's a definition of stick-to-itiveness. Noun. Propensity to follow through in a determined manner. Dogged persistence born of obligation and stubbornness. I'm like, oh, man, that's all you had to say. That's all you had to say. Now, I'm betting every one of you in this room is just like me, and we are kindred spirits. And when it comes to any kind of deceptions or lack of transparency about anything that is going to jeopardize my health, my family's health, and my children's health, boy, howdy, I'm going to tell you, you better go look up the definition of stick-to-itiveness, because I am determined, I am dogged, I am persistent, and I am not going to stand down until I find out the truth. And I know every one of you in this room is going to be just that.